am Dr. Mridubashini Govindarajan from Coimbatore, and what I have to say is a little story about Women's Center as a hospital which started here a few decades ago. I spent my training years mostly in US and in Canada, and what I was exposed to back in those years a few decades ago was a very interesting story, because women's health care was at its peak even then in those places. We had access to ultrasound. This was back in the 1970s, 80s and 90s. Ultrasound, and we had access to fetal monitoring. We had access to cancer prevention and a lot of other things that were happening in women's health care area were not available here when we moved back to India. And interesting things were happening here. If you think about it, it's still very true that if you look at a general hospital which is run by a government, the male wards for surgery, medicine or whatever it is, if the male ward has 100 beds, the female ward usually only has 50 beds. Okay, and it is, as I said, it's still true. When you're talking about 50% of the population being women, there is a gross inequality in the kind of care that's provided. And even today, if you look at the scenario of generally healthcare in all of India, there are so many brilliant multi-specialty hospitals populated with all kinds of different specialties and concentrating on things like onco-care is very given a lot of prominence, organ transplantation, yes, cardiovascular surgeries, renal surgeries, and very many things like that in different areas have been given a lot of importance. But if you look and see, there are not very many hospitals which are concentrating specifically on women's health care. And to my mind, women's health care is not just delivering babies or the odd hysterectomy that needs to be done. It's so much more than that, the peculiar things that women face in life. So they need organizations and departments which specialize in these kind of things. And this idea was the one which made me start this organization. And I wanted to call it a women's clinic because it was meant to look at not just diseases, but lifestyle problems as well in women. Because a lot of lifestyle problems were leading to many of the medical problems that we were facing in India. 50 years ago, diabetes was not that common in India. But today, 1/3 of pregnant women, by the time they have their babies, are diabetic. Okay? So the need for very specialized care for in a lot of different situations is very, very evident, and there are not very many institutions that are specifically concentrating on women's health care. So that was the thinking behind this organization. And once we started working on that thinking, it became obvious that it cannot be just OBGYN, that one person doing all of this. It's not possible because the specialty has become so vast that you needed to divide it into different areas and have people concentrating on those areas and really specializing in those areas. So what we have put together is several departments under women's health care, which is, we start with normal deliveries, pregnancies and deliveries. You need to have more of facilities for educating pregnant women about pregnancy, the care in pregnancy, the exercises in pregnancy, the diet, and what they shouldn't do and what they should do, and that type of thing. And facilities where they can present 24/7 and they'll get the cutting level edge care if there was a problem with the pregnancy. So we divided it into two different things. One was for normal pregnancies and natural childbirth. Natural childbirth department now concentrates on prenatal education, prenatal care, and educating people, and at the same exercises included with physiotherapists and childbirth educators, and concentrating on things like getting the mother ready for lactation, getting the mother ready for other cares that the baby will need after the delivery. And we have put in a special department called Natural Childbirth Department, where the facilities are now available for underwater care during labor, and specialized care during labor, which includes exercises that they can do and everything that is geared to looking forward to a natural childbirth and a normal childbirth at that. So that is part of the story where we want things to be normal for the normal woman who becomes pregnant. The other side of the story is that we needed a specialized area where high-risk pregnancies needed to be looked after. We call this area maternal and childbirth care and maternal-fetal care areas. MFM, maternal-fetal medicine, is the technical name given to it. And here all of the problem pregnancies come into focus, and it can be a problem with the mother that the mother carries, or it's a problem with the growing baby inside the uterus that we are now picking up with so many different kinds of testing. It could be genetic testing, it could be ultrasound, and it could be many things that happen in pregnancy in between medical problems in pregnancy, surgical problems in pregnancy, which make the pregnancy a high-risk pregnancy. Growth disorders of the baby is another one. The baby can get to be too big or too small, all of which is a problem. So there's a specialized maternal-fetal medicine department where all of the specialists are concentrating only on maternal and fetal childbirth and have a very high specialized knowledge in this area, which also includes genetics and counseling. This department also takes care of people who've lost pregnancies earlier, multiple pregnancy losses, and which can again be much of a challenge, to diagnose the reason for all these things. So this department functions differently with another specialty group of doctors, which may be 4 or 5 people in the department. The setup of a maternal-fetal medicine department then led to taking care of the newborn. When we were taking care of the newborn, it became obvious that because we were looking after mothers with a lot of problems, we needed a NICU, which is neonatal ICU. And neonatal ICU, it's a level 3 NICU, where even very small babies can be taken care of. So these days, I think we are capable of taking care of babies that are born at as early as 24 weeks and as small as 500 grams. We are able to take care of them. And taking care of them doesn't end there. Taking care of them until they reach a normal status where they can be transferred with the parents to their natural home, and they can be looking after that. And it's amazing these days that even these babies, the growth profile is absolutely normal, and by the time they catch up with the weeks, they are as normal as the babies that are delivered close to term. So that's again a challenge area which is now manned and chaired by specialists in that area, neonatal care and advanced neonatal care at that. Then comes the child care as well. All these normal babies that are going up need their vaccinations, need their care, need to be looked after when they come back with all kinds of little problems or infections and those type of things. And we have a pediatric department as well. So it's evolved. The MFM has now evolved into a very successful neonatal care unit, which also transfers babies in utero from outside. So people, pregnant mothers in preterm labor can be transferred, so they can deliver an at-risk baby here and get looked after from the moment of birth until they are fit to go home and ready to go home. So those 2 departments are very active departments for us and very needed departments for us. And beyond that, our early interest was in IVF, or in vitro fertilization, also known as assisted reproductive technology. Our interest in that started back in 1990s. Early 1990s, there were hardly a handful of units in all of India. That's when we needed a lot of support from different units which are doing very well outside India. The first test tube baby in Asia was delivered in Singapore at that time. And the entire unit at Singapore gave us the backup for training our own embryologists, our own clinicians. They were here helping us to set up the unit as well. So our IVF unit actually started early in 1990s, along with a handful of units in the rest of India. Very soon, not that much later, after the very first baby was born in India. So we have been now going for a few decades in this area. And our specialty is not just carrying out a procedure called ART or in vitro fertilization. There's a lot more to it. We are capable of dealing with the medical problems which lead to sterility or difficulty in conceiving or having a baby. There are several problems like that, metabolic problems, problems like polycystic ovaries, age of the mother, age of the father, In male infertility, there are sperm problems which result because of lifestyle factors in the male partner. Other major diseases such as fibroids and endometriosis and polycystic ovary syndrome, all of these need special care before a procedure is undertaken. So we have specialists undertaking all that care, getting these people ready for an ART procedure. Unfortunately, today ART procedure is looked upon as a standalone procedure. For the majority of problems that give rise to infertility, a lot of the treatment will have to be started earlier to control whatever their problem is for the outcome to be better. Only when the underlying problem is addressed earlier and then the procedure is carried out, the outcome is better. Therefore, we see a lot of people who are today are faced with a lot of people who undergo these procedures when the procedures are undertaken as a solitary procedure and the procedure fails, they feel the doors are shut for them. It is not so. I think it can be started right from the beginning, wherever their problems are, and the problems are sorted out earlier than the ART procedure, it works out to be much better. The same way, once the ART procedure is finished and the patient conceives, the story is not over, because an ART pregnancy needs very specialized care, because it can turn out to be a very high risk pregnancy, and there we are happy that our MFM departments are handling those kind of problems coming in. Subsequent to all of this, we've also started an onco unit, a breast diseases surgery unit, and a surgical unit as well, because women do want to have their breast problems or oncological problems to be looked after here. So we have a very strong team, onco team, supporting us to carry out all those procedures in this facility. So on the whole, and besides all of this, we have got a wellness program, which is a very special program for us. Wellness program involves around issues such as polycystic ovary syndrome, menopause, obesity in women, diabetes in women. All of these things, they give rise to multiple organ problems. So therefore, our concentration especially has been on hormone dependent generalized problems, which can become wellness problems, which is diabetes and obesity, and especially polycystic ovary syndrome. Polycystic ovary syndrome is today present in about something like 20% of Indian women, and majority of countries have it as 15%, but insulin resistance is very high in Indian society. Therefore, our incidence of polycystic ovary also is higher, and these can be diagnosed in adolescence, so adolescent care also becomes very important with these kind of situations today. So from psychological to polycystic ovary care, which ensures that they have a good future and no fertility problems in the future, no metabolic problems in the future. So that also becomes very, very important. So today we are dealing with every aspect of women's health care, and wellness is also becoming a very, very important part of it, because menopause is another area, urogenital problems is another area, urogynecology. Not very many hospitals which are concentrating urogynecological problems, especially in the older women. That is also requiring a lot of attention today. So on the whole, I am happy to say that we have made Women's Center into a comprehensive center which looks at everything. And the last but not the least thing is, now today we are working with Motherhood. Motherhood organization is known for its multiple centers which are dealing with women's health care. So once the center is established with several different areas, we needed somebody who could do appropriate justice for management in this kind of an area, and we looked for a partner to work with. And I think today we have this very wonderful partnership which is providing comprehensive care for all of these different areas, and we are there as a standalone different kind of unit which caters to almost all of women's health care. Thank you.